Good afternoon. I'm Dr. LeKeyah Wilson, Medical Director of the School-Based Health Centers associated with Rochester Regional Health.
And I'm Eve Gotham. I'm the Director of Child and Youth Services at Rochester Regional Health.
And the month of May is the Mental Health Awareness Month, and we are here to talk about mental health in our adolescent population.
So this is an important topic. Both LeKeyah and I see teenagers, and so we also invite questions that you may have if you're watching this today. Please leave them in the comments and we'll be sure to respond.
Yes. So even though there's a lot more publicity, healthcare around mental health, there's still a lot of stigma associated with that. And we are working hard in our primary care offices and our mental health offices as well to help reduce that stigma and to get this adolescents and their families the help and the services that they need.
Yeah, an interesting fact is that some research was done, and in a survey, people will say that they see behavioral health, mental health, and physical health as the same. But what we do know is that people are much more hesitant about seeking assistance for mental health, whether it be for themselves or for their children.
Exactly. I will. When I see patients in my office, often the families are very hesitant to have a mental health diagnosis or even a treatment plan put in place for their child.
Yeah. The good news is behavioral health, mental health diagnoses are actually quite easily treated, just like other physical health conditions like allergies or asthmas. They are chronic, they do need work, but can be treated just as easily as the rest.
Correct. And it's very important to screen for these mental health problems, issues, concerns, or what have you, because it also does impact the well-being of your child. It can impact their asthma. If your daughter or son has anxiety, that actually can make their asthma worse. They can have a panic attack that presents very similar to an asthma attack.
And interesting, I was reading this weekend that a lot of physical health symptoms do signal other things, such as headaches, stomach aches. And so what we think may be physical could be just as easily treated with a little cognitive behavior therapy or other very brief interventions in a therapeutic setting.
I couldn't agree more.
You guys are both parents. How do you have conversations like that with your kids? That you might be noticing changes. How do you have conversations and how do you pitch that to them?
Mm-hmm. So from a very early age, when my children started to learn how to speak, we always incorporated say how you feel. Put a word to that emotion versus crying, stomping, rolling around on the ground. And so my children are actually very vocal with expressing their emotions, and we do spend time talking about what does that mean. You're angry. Tell mommy why you're angry. And let's see if we can come together to come up with a solution to figure out what we can do to improve the situation and decrease some of your anger that you're having.
Mm-hmm. And I'm a big fan of scales. So I used a lot of, when my son was young, either color coding or now that he's older, numbers. So like on a scale of 1 to 10, how angry are you? On a scale of 1 to 10, how sad are you? And that's a little easier to kind of, for me to get a picture of what's going on. Mm-hmm. But I think both of us also start to ask questions when we notice subtle changes. So if a child is often very talkative and then they suddenly become quiet, that's a change. We would want to ask some questions.
Correct.
A kid that's usually in a good mood suddenly becomes pretty irritable and angry. Something might be bothering them.
Exactly. And so calling that out. So, hey, Johnny, I noticed in the past week when I ask you to do X, Y, Z, you get very upset. You throw things. You start crying. What's going on? What is causing this change, and have you noticed this change?
Mm-hmm. And I think a lot of kids don't want to disappoint their parents, so they'll hold back. They'll say everything's okay, and we have to really be very persistent as parents to keep going, keep asking in a lot of different ways, because one of the wonderful things about kids is they don't want their parents to be upset with them. They don't want to disappoint. Most kids want to be doing the right thing. So I think I've had to really get good at asking lots of different questions in lots of different ways.
Yes, yes. One of the other things that I incorporate with my children is when I pick them up from school, we start off our conversation with, how was school today? And most of the time your child will say fine, okay, or whatnot. And that's not enough information for me. So I then say, tell me one good thing and one bad thing that happened today in school. And that actually gets the dialogue started. And so we have that conversation every day, and then we also have conversations at dinner time.
I agree. Same kind of thing. So as a parent, we encourage you to ask these questions. Like Dr. Wilson said, riding in the car is a great time to ask serious questions because they're in there and they can't go anywhere. And the good news is kids have some education. School districts are doing a great job about teaching awareness of mental health, and things continue to get better. So they do know some stuff. They've done a lot of work about internet safety and bullying and everything. So they kind of know some of the words to say. Once we get them going, they keep the conversation going.
Exactly.
And even for them to sometimes teach us things, hey, I learned this at school today, let me teach you. And all of those things are called resilience building kind of activities. And that, I think, is one of the most promising and exciting frontiers that's coming in children's behavioral health, is teaching kids how to build resiliency, have the skills to solve problems, and then be able to kind of take it on their own. Because inevitably, some difficult challenges come at us in life, and the better skills and resiliency we can have, the better off we will be when those challenges come to us.
Exactly. I was very excited when my children came home talking about mindfulness and that they were learning that in school. And so my kids are incorporating this concept of being mindful where their body is, their emotions, and how they are responding to the environment. And it actually brings it down just a little bit, and they're able to focus a little bit of what needs to be addressed at that moment, which is very exciting to learning at this age.
Yeah. And I think both of us as parents and as practitioners, we're both very direct. So we ask questions. We don't skirt around the issues. So we would encourage you also to just be direct. Even about difficult topics like depression or suicide, use the words, ask directly.
Right.
Don't be afraid. Because when you don't ask with the direct words, you might not get to the answer that you're looking for.
Exactly. And often I tell my children, I do want them to be honest with me. Even if they think it's going to hurt my feelings, my job is to protect them. So therefore, I need to know the truth about what's going on with them and in their lives with their friends as well.
Yes, absolutely.
Depression is on the rise nationally. Any reasoning why you guys think it might be on the rise? And again, can you just give advice on how to talk to your kids about what they're going through?
So I think there's a combination of why we may see things on the rise. One is we're better at looking and finding it.
I agree.
I also think that kids have a tremendous amount of stress in the world right now that does complicate their lives and the world that they live in. And that may also attribute to an increase.
I agree, because the exposure that our youth gets this day and age compared to 20 years ago is a lot more information, especially on social media and what have you. And so they're dealing with a lot more world issues and local issues, and not knowing how to really navigate those feelings and emotions. And they're going to actually identify with those individuals on television or the internet and saying, could this actually happen to me? So in the primary care office, we do screening at least once a year for depression and anxiety in our youth. And as a parent, you want, again, notice some changes in your child's behavior like we were discussing before. More sleepy than normal or more activated than normal, showing irritability, just changes in emotions, more quiet than normal, changes in appetite. Those are the type of things that are a little bit of a red flag for you, and you need to have a conversation with your child or bring them to a health professional.
I also think for older teenagers, sometimes experimentation with alcohol and drugs, smoking, those other kinds of things often could be a way to try and feel better if a child is not feeling better. Sometimes it is, sometimes it isn't. Right. It's important to ask the questions.
Right.
How do you teach your kids too that social media, while it's something people are putting out there, may not always be reality for people? How do you talk to your kids about that?
I talk about it in a very similar way I talk about TV and movies, that everyone kind of puts their best foot forward in social media. And so some of it may not be completely true. Just like, and I'll equate it back to a movie or a TV show where I kind of say, we've talked about that some of that is pretend.
Right.
And so really trying to normalize that everything is not perfect all the time, nor does it need to be. Because I think that young people today do have a feeling that everything needs to kind of go exactly as planned and be great.
Yes.
And, I so wish life was like that.
Exactly. With my children, I spend a lot of time talking about fact and opinion. And that with what's on the media, a lot of that's opinionated. The information comes so rapidly. We want to know exactly what's happening right at that moment, where it doesn't allow enough time to get all of the facts. So explaining that to my children, which I think they can understand because they're learning about opinion essays and whatnot in school. So that kind of helps put a different lens on it for my children.
All right. Well, we really appreciate you watching us today. Again, we encourage you, if you have any questions at all, to please leave a comment. One of us will reach out or respond. And if you ever need to reach out, Rochester Regional Health has an array of both pediatric and behavioral health services that we are happy to work with you and your family for whatever you need.
Exactly. You guys enjoy the rest of your day.
Thanks.